Hello and welcome to The Society with Fatma Shaheen at PTV World. WHO has recently reported the fact that in Pakistan, the suicide rate has crossed 8%. And there are also studies to suggest the fact that 1 out of every 200 people in Pakistan is prone to, or for that matter, at any point or the other, has actually attempted to commit suicide. We also see that in the past few years, the statistics, the numbers of suicide cases has largely grown in the country, more so in the younger population. Why is that the case? This is exactly what we'll be talking about during the course of today's conversation. We'll also be talking about the gender paradox as it does exist when it comes to, suicide and related cases. In this regard, we must mention the fact that, this gender paradox very clearly states that women attempt suicide more compared to men, and men actually, do it. Why is that the case again? Looking at it from a psychological perspective, this is also something upon which we'll be shedding light in today's show. We'll be talking about not only, of course, the causes which we can, directly or indirectly attribute to suicide, increasing cases of suicide in the country, but we'll also be talking about, of course, the very imminent need to raise community awareness about the same. Why is it so important to talk about prevention strategies, and why should, of course, suicide, like other mental health disorders, be prioritized not only at a local level but also at a national, rather at an international level, when it comes to talking about taking care of the public health. This and much more to follow on today's show, and to do that, let me introduce you to my today's panel. My first panelist for the show today is Ms. Fatma Ali Waheed, who's a youth activist. Assalamu alaikum ji, and welcome to the show.
Thank you so much.
You're most welcome. My second panelist for the show today is Dr. Shazib Shamim Saab, who's a psychiatrist. Assalamu alaikum sir, and welcome to the show.
Walaikum assalam. Thank you very much.
You're most welcome. And via Zoom link, we'll be joined by Taha Sabri Saab, who's a mental health expert. Assalamu alaikum sir, and welcome to the show.
Thank you. Walaikum assalam.
You're most welcome. To get the conversation started with you, at a very basic level, this is something which I just mentioned in my introduction as well. We do see that, there has been rise in the cases of suicide, more so when it comes to the younger population in Pakistan. But as a young person yourself, what reasons do you feel actually are responsible for the same?
So when we talk about why young people are more prone to suicide, I don't think there's any one particular reason that we can pinpoint, right? But it stems down to feelings of hopelessness and helplessness in young people. And that could be because of a couple of reasons, right? So first of all, I think there's so much unhealthy social media exposure. And then because of toxic family environments. Also, the most important reason I feel here is the lack of accessibility to mental health treatment, right? And when younger people are going through such struggles themselves, the thing that they need, they can't just snap out of it, right? They can't just wake up one day and stop feeling the way that they're feeling, right? They need like consistent and proper support to change their irrational thoughts into more rational ones, right? And when they do not get that mental health treatment that they need, their schemas keep on getting more strengthened, and then they eventually reach this breaking point, which is
because of which, of course, they then actually become more prone to, or for that matter, attempt to commit basically suicide. So basically, in your opinion, it's just not one factor, it's a combination of factors. From, of course, there being various socio-cultural reasons to, of course, pressures from family, perhaps, from other quarters of anybody's life. And in that regard, it's also very important to mention the barriers which do exist with regards to seeking mental health treatment timely. Sir, coming towards you, I think Ms. Fatma has raised some very valid points on which I would want you to deliberate further. I think she's mentioned this socio-cultural aspect. This is a very important reason because of which we do see a very alarming, rise in the cases of suicide, so to speak. But as somebody who has worked on the ground, do you agree with what she said? Because at least one thing is clear, that, in a society like ours, we do see, unfortunately, a lot of people thinking, more so younger people thinking that, committing suicide perhaps, or for that matter, inflicting self-harm is that one way of getting rid of all their personal dilemmas.
So I think that it is a complex issue. And as that young lady also mentioned, that it is a very multifaceted issue. But what's important to understand about suicide is that suicide is not a disease, right? Suicide is the complication of a disease, which is mental illness, mental health problems. And when people with mental health problems, psychological problems, do not receive appropriate mental health support, and then their reality becomes intolerable to bear. So suicide is an attempt to escape from a reality that is too intolerable to bear, in its simplest sense, right? The question is, why is this happening? Why is the reality of our youth becoming intolerable to bear that they are resorting to means of suicide? And I think the answer is, of course, is quite complex. But what we found through our work, through our helpline and service, the people who call us for help, for mental health support, the three main reasons which are leading to these problems among people. The first one is problem with parents. There is a generational gap between parents and their children, as a result of which there is a lack of communication, as a result of which distress is increasing amongst them. Number two is problems in romantic relationships with spouses, with partners. So those are the second most reason. And in fact, Pakistan is one of the only countries in the world where marriage increases the chances of a mental illness in females.
Sir. That is so rightly put by yourself, because we also do practically see that a lot of people, after their marriages do end, they seek divorces. After that, they fall victim, unfortunately, to different kind of mental health diseases, which then in turn are, of course, responsible to them committing suicide. Coming back to you, Shazib Saab, I think we must also talk about your narrative here, because you've also been treating people over a period of time. So how do you see the trends and the patterns with regards to suicide evolving over a period of time? Because a lot of times we see that people who have those tendencies, they are not very open to even talking about it. So how do you, as a psychiatrist, then actually make them admit that yes, they have mental health issues, and yes, they do need help?
First of all, Fatima, I'm really thankful to you for inviting
welcome.
me over this topic. This is not only just a topic which is important for our country, it's actually a global topic.
Right, sir.
And it's given very much importance all over the world now. You started your program with the data and some aspects of the WHO findings.
Right.
And also you mentioned towards the difference between the type of suicidal attempts. So what we call in psychiatry is attempted suicide, and suicidal attempt is a different thing.
Right.
And most women, they come up with attempted suicide.
Right, sir.
And even children as well. And that is actually meant for having some attention-seeking goals or some kind of short-term goals to be made for. And suicidal attempt is different from attempted suicide.
Right.
So normally attempted suicide never comes up with the achievement of the suicide.
Of course, because you have attempted it, but you failed at it. And the other thing is basically that, you are planning to do it.
Yeah. And when we see in the clinical settings, normally the women attempt for the suicides more, but they are most oftenly they are not successful.
This is exactly, sir, why I posed this, because I think this is a very, kind of a paradox that we see, that, women, they do attempt it more, but, more often than not,
they get less successful.
Right.
There's so many mental health disorders behind all this. If someone comes up with a pattern of taking one's life, there are a lot many dynamics which one of the panelists was talking about. Lot many dynamics come into it. They are the factors which start from the brain, the neurotransmitters, the mindset, and the psychopathology in the brain, and probably one of or more than one underlying mental health disorders, which may include mood disorders, chronic depressive illness, bipolar affective disorder, or coming towards personality disorders.
So, but it's very important for us to, clarify to the audience that it's always just not related to you having, a diagnosed, or for that matter, an untreated, depressive order, any of the, orders that you have mentioned, because a lot of times we see that, these attempts are made on the spur of the moment, like because of some provocation, like we have seen people who have actually committed suicide because they felt very let down in life, because of a certain incident which happened in their life, so to speak. So I think it's then, of course, an amalgamation of so many other things. So coming to you, Fatma, I think we must also talk about, of course, the role of social media. We do see that whereas, of course, social media has that power to educate people, it also, on the converse, has that power to scare people. And when, when we talk about this in the context of course, this emerging role of digital media influencers, so to speak, we do see that there have been cases. I remember this very famous case of this model, Anam Tanoli, who actually committed suicide because of being cyberbullied with regards to her weight and how she looked. So in this regard, when it comes to the role of social media, more specifically with regards to young people, how important, how pressing do you feel? Is it a reason with regards to, of course, contributing towards this increasing suicide rate in the country?
Right, of course, I think social media, because it is so accessible to people of all ages at this point, it plays a very important role in contributing to suicide, right? I feel like young people in specific, they are, when they see something on social media, which maybe, and they idealize that thing, it may be difficult for them to separate themselves from what they're seeing versus what is the reality, right? And in that regards, also, I think social media, the time that they spend on social media is so unregulated that they, while it might be easier for an older person to sort of tell themselves that what they're seeing is not the reality, it is not the ground reality, right? It may be difficult for a person who's so young to tell themselves that what they're seeing on their Instagram reels or their favorite influencer doing is actually not the truth.
Right. So basically, it's difficult for them, again, to make that distinction between what is right and what is wrong. So you wanted to add something to this. I think in this regard, it's also very important to have your real life experiences, because I'm sure you get to treat so many people, young people, elderly people, men, women. So with regards to the experiences that you have, do you feel that media actually contributes to this increasing suicide rate?
It does. It contributes significantly, especially the social media, the relationships, the work, the life, the occupation, the socialization built on the cyberspace is actually very different from the one happening in the real life.
Right.
And apart from substance misuse, apart from the physical, sexual, emotional abuse background, apart from the personality disorders and mood disorders, cyber addiction and the cyber socialization is also contributing towards the rising suicide, because there's a lot of gap between the expectation and the reality.
Right.
So that gap actually comes up with a problem that the people who flourish their relationships or the businesses or the politics on the social media, when they come into the cognition of the real life and the behaviors of the real life, they find it very contradictory over there.
Right. And I think in this regard, we must also, of course, talk about the fact that, last year we also saw this very young boy who was, just 14 years of age. He actually murdered his family, being influenced by this, video game, which actually incited violence in him. So when it comes to, of course, children, or for that matter, young adults or teenagers playing video games, do you attribute video games also being a reason because of which children then become more prone to inflicting self-harm upon themselves?
Very much, because especially the children who are high achievers, either in academics, either in the social media, in this cyber games, or either in any aspect of life, and especially the relationships, who tend to be very perfectionist towards the relationships. So when they don't come up with the high success rate into the games, the relationships, the academics, they are at a very high risk of committing suicide. And I know one of my patients, he was a A-level student, and he got straight A's and in his O-levels, and he got 2 B's and 1 C in A-levels, and that was enough reason for him to commit suicide, because he thought he is not coming up to the mark. Similarly, the romantic relationship with one of the panelists was also mentioning, people come up with a lot of perfectionist expectations into it.
Right, so your point is noted, on which I'll come to you, Taha Sab. I think we must also, of course, talk about these very interesting educational awareness sessions which you have been conducting, not only in educational institutions, of course, but also in different organizations. So tell us more about these sessions, that how particularly are they aimed in making people, the average Pakistani out there, more about their mental health issues?
So I think what is important is that to realize is that according to statistics, it takes around 7 years for someone to seek help after starting developing symptoms of mental health problems. So people are not even aware that they're having these issues in the first place. And by the time they seek help, it's already very late. So, and that's why the suicide rate is also going up, because since we are not addressing these issues in the root, they are then resulting in these complications. So what our sessions sort of focus on is to increase awareness about the importance of mental health, reduce stigma against help seeking for mental illness by encouraging people to seek help, and then connecting them with services. For example, with suicide, I think a very common educational thing which is very important to know, like the terminology around suicide can increase its occurrence. For example, the word commit. So the word commit is used for crimes, right? That he committed a robbery, he committed an arson. We would never say that he committed a heart attack. We would say he had a heart attack. So the terminology we use can increase the stigma. So that's why the word commit is to use with suicide actually makes things worse. So we must use language which can help destigmatize the issue
Of
and
course.
encourage those affected to seek help.
Right, so I think that's a point very well put by yourself, but I would want you to deliberate on this further. When we talk about, of course, sensitizing people in order to use, sensitive language when it actually comes to even referring, to such acts, how do you actually do it? More so in educational institutions where, of course, you do come across children or young adults who are very young and who don't actually understand the repercussions of such sensitive things.
Yes, so the mediums that we use are, number one, it is the age of media. So we use social media and mass media in which we run different campaigns around different aspects of mental health using short films, videos of people who've recovered from these problems, and also animations, multilingual. And then we also do workshops, resilience building workshops. In schools, we've recently developed a mental health chatbot, which we are piloting and which we hope to eventually take to many schools. And the role of the chatbot is to have an automated sort of educational experience in which students can learn more about mental health. There will be a basic mental health screening to ascertain their mental health status, whether they require help or not. And then if required, the chatbot will connect students who require support to our free of cost tele-mental health services.
Right, sir. And I think in this regard, we must, of course, also talk about, of course, extending the scope of these awareness sessions to the rural areas of the countries where, of course, the mental health taboo is definitely more than what it is in the urban parts of the country. So how do you particularly target these areas?
So that's the reason that we have telephonic services. The point of our services is making mental health accessible to the most underserved communities. And so 70% of all mental health services in Pakistan are in Karachi.
Right.
Around 15 to 20% are in Lahore, 5% in Islamabad, and the rest are spread between Peshawar and Quetta. Very few services. So that is why, and creating brick and mortar services is very expensive. So that is the reason we went for telephonic services, because mental health is an intervention that to some degree can be offered over a call.
Right, sir. Your point is noted, on which I'll come to you, Dr. Saab. I think he's raised some very valid points, but I think we must also talk about those category of cases in which we see that, these incidents, they occur not because of a diagnosed or for that matter, an untreated, kind of a psychological or any mental health disorder that anybody is suffering from. They occur because of any kind of, a provocation that might have occurred at a certain instance, because of which, the person could not take that blow and they as a consequence have committed suicide. So in cases like these, what would be the warning signs for people out there, and how can we then work towards a more preemptive and of course a preventive approach, because all those cases wouldn't neatly fall in the categories that you have pinpointed, which is that of course people having a recognized or a diagnosed mental health disorder and a consequent of that actually committing suicide.
So first of all, the bad news declaration in any clinical setting, in any legal setting, in any social setting, should be considered as a very sensitive way of human communication.
Right.
Either there has to be some kind of a more ethical code related to it, or maybe some kind of a better legislation related to it. Especially the doctors, they are very well trained into it. Either it's a surgeon or a medical physician or a psychiatrist or anyone, the explanation or the declaration of the bad news has to be done very sensitively, and it has to be done very privately. So, but unfortunately in our society we see in the legal settings, the social settings, the media coverage is very naked everywhere. There has to be certain responsibility the media should be following.
I think this is something which Taha Sabri also earlier pointed out, on which I'll come to you, Fatma. I think we must also of course talk about the need for there to be responsible media coverage. In this regard, I think it's very important to talk about the fact that why is there a very pressing need for this, the way the cases are reported of suicide per se, why the focus needs to shift from not glorifying such acts to being one in which basically such acts and of course the commission of suicide is reported in a more objective, a more factual, and by that virtue a more empathetic manner.
Right, so here I would want to talk about how young people are exposed to media in terms of the TV shows that they watch and the content that they consume, right? There is a lot of portrayal of mental health issues in media. They also often portray mental health issues in a very negative light. They often show them as extremists, and they would a lot of times reduce those people that they're showing, those people with mental health issues, to their diagnosis, right? And it is very important as a society that we see people with a mental health diagnosis or those people who are struggling with mental health issues as something outside of their diagnosis, right?
It shouldn't be related to their identity per se,
Exactly.
because I think this is something which applies in case of any illness. So basically, you know, in continuation to what you said, I think we must also of course talk about you know, the need for there to be more empathetic and of course by that virtue compassionate reporting of such incidents. So what changes do you propose should be made with regards to media reporting when it comes to, you know, actually covering such incidents?
Right, so I think it's very important that there is more sensitive reporting when we're reporting suicide cases in Pakistan, right? For example, we talked about how using attempted suicide it actually further propagates the negative connotations that are already attached to mental health issues, right? And instead, if we use the term died by suicide, that would actually be so much more helpful, because when we use the term committed suicide, we're actually putting the person who is in question in showing the person who is in question as a culprit who did something that they should not have done or they could have controlled, right? But it is very important to consider that these people in that moment think that is what is the most rational thing to do, right? And when we shift the conversation from who attempted suicide to who died by suicide, we're actually shifting the narrative and focusing more on the right question, which is not what happened, but instead what should have happened and what did not happen.
Right. Fatma, your point is noted, on which I'll come to you, Taha Sab. I think we must of course also talk about the very imminent role of parents and of course our elders in this regard. We do see that, you know, in a lot of cases, parents do pressurize their children to of course acquire certain standards in life, for that matter, you know, even in terms of achieving certain results in schools or colleges. And you know, when children fail to do that, they feel so pressurized that, you know, as a consequence we have seen them actually commit suicide. So as somebody who of course has that benefit of course giving, you know, these very informative and of course educational awareness sessions, not only to educational institutions but also to different organizations, do like your you know, awareness sessions also extend to sensitizing parents about the need to actually deal with their children in a more compassionate, in a more sensitive manner?
I think that's what we talk about, as we mentioned, that parenting is the foundation of our mental health, right? So the type of parenting that we experience as children and the bonds we form with our parents, they determine the kind of relationships we'll have and our behavior in the future. In fact, it's also, our behavior is also coded in our genes, what we now call epigenetics. So essentially parental behaviors pass on to the children in their genes, and those children are then are genetically coded to repeat those behaviors as well. So that's also for the parent is an addict.
Right.
That's
very rightly pointed by yourself, because we have seen a lot of times children who are prone to actually committing suicide have actually shown to have a family history of the same, on which I'll come to you, Dr. Sab. I think your narrative here again becomes very relevant, because of course you have that practical viewpoint of this issue. So when it comes to of course treating such patients, I think the ideal situation would be that somebody comes to you, they tell you that, you know, they have suicidal inclinations, or for that matter they are suffering from any XYZ mental health disorder. But at the end of the day, in the event that they don't do that, how then do you actually seek an admission from them, and how then do you in turn treat them?
I again reinforce over here Taha's initiative towards the anti-stigmatic approach towards suicide. When it comes to mental health and other medical specialties, we see sharing the family history is a fashion when it comes to cardiology. Oh, my grandparents were having this and they got this, angiography, angioplasty, all these terms are so fascinating to be told to the relatives and everyone. But when it comes to mental health, people tend to hide their family histories. So if I'm going to talk to you about my own childhood brought up, and if I'm going to talk to you about my own early teenage, it will be very difficult for you or anyone to understand or actually empathize with the kind of attachment issues I could have been having difficulty with my own parents.
So this is why I actually posed the question that, you know, then I think that's a very big challenge for people like yourself sitting at the other end, expected to treat that person, to treat them, because of course your patient is not being honest with you. So how then you know, address this
First
issue?
is the shame healing. When it comes to parents, which Taha was talking, and you put that question to Taha about the parenting and the role of parenting in bringing up these issues of suicide. Of course, he's very right that the attachment styles, which can be avoidant, which can be anxious, which can be semi-anxious, which can be totally non-compliant with their own children for the upbringing. So shame and the toxic shame is the first thing. And also I would like to point over here the role of media. When it comes to the sensitive conversations like these topics, media also tends to induce through the movies, through the contents and through the social media.
So, but on the contrary, we've also seen that, you know, there have been films made actually on this very pressing issue of suicide. So I think slowly and gradually we do see actually media giving due coverage to these issues too. But when it comes to, you know, treatment options, what are the treatment options that anybody has in the event that they do have suicidal tendencies, and why is it so important for them to actually seek help from the right mental health care worker? Because I understand that, of course, there are bifurcations.
When Oprah Winfrey shares her statements of being having a history of child abuse, that becomes headlines in the newspapers. But if Dr. Shazib is going to share about the child abuse of his own background, his own history, it's going to be very stigmatic and it's going to be very judgmental taken by the society. So that's how we are actually differently perceiving the things in the East and the West. Now coming towards the management of it. Management first of all includes the shame healing which an individual is going through. So no matter what, if I ask you that you ever had a suicidal or self-harming tendency or ever thought of taking your life, even if you would had that, or even if I would had that, I would never, or you would never be easily sharing it to anyone. So first of all is the shame healing, because there is so much shame attached to it. Even if Taha is there, or even if Fatima is there, or even I'm there sitting as a mental health professional, parents and the patients, they tend to take toxic shame in sharing about this topic.
That is so rightly put by yourself, and that is exactly something that we need to work on, because I think the first step is sensitization. It is making people aware that there is a problem and there's no problem.
And there's no shame.
There's no shame exactly in
about
seeking
it.
for help.
And then coming towards the medicines and the counseling and the social training programs. Like we do intervention into every field, from education to medical science to surgical skills and everything. We have an intervention style in every specialty. Same goes for mental health. The medicines, the counselings and the social trainings and the lifestyle management, they need to be taken very seriously.
Right, so your point is noted, on which I'll come to you, Fatma. And to conclude today's show, I think a very important aspect which we must cover, you know, before we conclude today's show is the fact that, you know, how does suicide per se impact the society at large? Now, of course, we can't ignore the fact that suicide, of course, impacts, the family members, the friends of the person who has unfortunately passed away. But we also must not ignore the fact that it has that, you know, ripple way effect on the community, on the society at large. So as a young person, where do you see the correlation?
Right, I think that a suicide definitely does have a ripple wave effect, right? So when one person dies by suicide, a lot of other people who are struggling with their own mental health issues might consider that as an option for themselves, right? And then when we hear about somebody passing away, it is extremely devastating for us, right? And on top of that, when we hear that somebody passed away because of suicide, that is even more, that adds to the grief, right? If it is somebody close to us, we constantly question and relive the moments that we've had with them, thinking, where did we go wrong, right? So we have this tendency to put the blame on us and think like, maybe if we could have done one thing differently, this would not have happened. And then this could also turn into complicated grief, right? Where where you're unable to get over what is happening, and that becomes a hindrance in there.
And I think that is also a problem that we do need to address at the end of the day. Dr. Sabri, I'll put the question to you, because I think you'll of course have a practical viewpoint on this, that, you know, a lot of times we see that the discussion is just limited to the act of suicide itself, and we often ignore, of course, you know, the psychological or the psychiatric element of the grief that it brings to the family who has to live through the blow at the end of the day. So, you know, as a psychiatrist yourself, how do you feel can, you know, the family members, how do you feel can, of course, the friends of the person who has passed away deal with this grief, because it is very complicated at the end of the day?
Yes, this is also a very important aspect you have touched. Once someone loses their loved ones because of suicide, the whole family goes into, especially the sensitive individuals in the family, they go through a certain amount of guilt. And they feel partially or fully responsible about not knowing their loved ones getting into that trouble. So if something like this happens and they lose their loved ones, then after that the family has to be taken seriously,
right,
and especially by the community and also by the clinical settings. The individual assessment of the remaining members, that has to be done, that should be done, and we should be screening out the psychopathology in the family, because
Right.
often the certain dysfunctional families come up with such kind of victims of suicide.
right,
We also need to see, apart from this, we also need to see that there should be some community support groups for certain families
Of
where
course.
they suffer like this. One more point which is very important for prevention is actually the perception of suicide through media.
Right.
It has to be taken in a way that like religiously it's condemned to take one's life.
Right, sir, your point is noted, on which I'll come to you, Taha Sabri. And before we conclude today's show, I think it's extremely important that we also talk about this very important role of the government when it comes to, of course, suicide prevention. I understand the fact that you've very actively been working with the government in this regard. So tell us that, what has been the scope of your activities with the government in this regard. Do the activities just, focus on creating community awareness, or do they go a step ahead and also, focus on, of course, having effective suicide prevention strategies in place?
Of course, the government is, of course, very willing to help people. And we have been working with them on different aspects. One aspect is sort of seeing that how can we treat suicide as a medical issue instead of a criminal one, so that people can get the help that they need. So that's a very important aspect. The second aspect is, of course, regulation of mental health professionals, because that is also an aspect, because patients with mental illness are very vulnerable, and and people take advantage of them, especially people posing as mental health professionals. So that is fake doctors, or that's a big issue. So we're working with them. We recently launched a report with the National Commission of Human Rights on that, and we're now developing a law, a Mental Health Act, which we hope to introduce into the National Assembly to update the legislation. And lastly, I think the most important thing is, and which we really hope to work with the government on, we've already discussed it with certain members of the government, is the development of a national mental health helpline.
Right.
That is essential.
Right.
And for that, our services are available to the state. We have the model, we have piloted it, it's proven successful. Now all we need to do is scale it. So that's what we hope to do with the government.
And I think in this regard, we must, of course, talk about prioritizing, having such suicide prevention strategies in place. And this is something which, of course, not only must Pakistan do, this is something which the rest of the world should also do, because we understand the fact that suicide is rampant, and not only in Pakistan, but world over too. Right, so your point is noted, on which note I would like to conclude today's show. Thank you so much, Ms. Fatma, for being here with us today. Thank you so much, Dr. for joining us. And thank you so much, Taha Sabri, for being here with us today. Well, to conclude today's show, we generally spoke about, this pressing issue of mental health disorders, and of course, those disorders which actually are responsible for suicide in Pakistan. We also spoke about the changing trends as they do exist when it comes to suicide in the country. We also spoke about the fact that, there is this very pressing, rather a very interesting kind of a gender paradox when it comes to suicide in the country. And, how do we on paper actually explain the causes for the same. Last but not the least, we also spoke about the need for there to be community awareness when it comes to suicide prevention. Why is it so important to break free from the taboo and actually have these honest and, of course, truthful conversations about mental health issues that people do suffer from, because at the end of the day, we need to teach people how to love themselves. Self-love indeed is the best way in which you can take your power back, and this is something that we need to inculcate in our Pakistani society at a very basic level. Thank you for joining us today. Until next time, take care and Allah Hafiz.